So you have been through, at this point, different iterations of treatment, and another 4 or 5 years pass by, actually, and you're doing your Stephen thing and living your active lifestyle. What happens again that brings on the third discussion of having to pursue more treatment?
Well, again, even though I was doing my thing and feeling good and all systems were normal and go, again, I was still having those appointments every 3 months just to confirm that, just because I felt okay. I needed my doctor to tell me I feel okay. Um, and like I said, we will always have those conversations about what's next. Even if even if even if the topic of conversation isn't we need to talk about what's next, we're going to have the conversation anyway because that's just the way, that's the nature of the beast with a disease like this. So we had spoken about ibrutinib a couple times over the course of a year probably. Um, and he had said, I've got several people, well, I've got a lot of people on this. The practice has had great luck with it. I think if and when the time's right, that's probably going to be what's next for you. But he said, I have to warn you, I think it's a little pricey. So we're going to have to work through all that if and when the time comes. But I think that's going to be the next option for you. So that's how he that's how he framed it for me. But then it wasn't until several months, a year, maybe even longer, that he said, I think it's time, because symptoms came back, lymph nodes were swollen, CT scan revealed more lymph node movement from prior, white count was on the climb, and it was, okay, what's next? Look, I look at it like this. You keep going to the same restaurant, and every time you go in there, there's a new menu, which is pretty cool, right? It keeps things fresh, and you're not going to get sick of the same food because you're looking at something different every time you go in there. And I kind of feel like that's been the options whenever I walk into the oncology office and I need treatment, right? So what is the special of the day? And by day I mean year, or what's the protocol for this period of time.
Yeah.
And at this time it was Imbruvica. That was the hot topic, that was the hot drug. And we took a shot at it, and I have to tell you, it was probably the best thing we've ever done. Once again, going into it, in the back of my head, I'm thinking, I don't know what this is going to feel like. I don't know. You read the side effects, and of course, the potential side effects, I should say, excuse me. As with any medication, or you watch any TV, any ad that you see on TV, you hear the disclaimers and you think, my God, I'm never going to take that. The side effects are going to kill me before whatever that I'm being treated for is going to kill me. So I was a little concerned about some of the side effects that I have read about, but they were boilerplate, standard cookie cutter type. I experienced basically none of them, and I was extremely happy about it. I was able to maintain my lifestyle. I was able to keep going with what I was doing. It was literally once, good call. It was literally one small pill taken once in the morning, with only one other supplemental drug I would take with it called allopurinol. And all that does is help the body rid some of the toxins that accumulate from that. Similarly to a patient with gout or with some other disease where they need to rid the system of some of that stuff.
Mm.
Um, that combination, the ibrutinib with a little bit of allopurinol has, now it's 3 years in, and it's just been a very positive experience. I fill the prescription right there at my oncologist office. I can run down to pick it up and run back home again, which, talk about the ultimate feeling of empowerment, right? I run from our place down to go pick up chemo, throw it in my little slingback bag, and I run back up the hill, and I feel like, okay, yeah, maybe I have leukemia, and maybe I just had to go pick up my targeted therapy drug. But you know what? I'm kicking its butt because now I'm running home from picking up my drug, and now I'm just going to settle back into my lifestyle.
I'm so happy to hear that. And as you were saying, this targeted therapy drug, BTK inhibitor, and all that great jargon. But and then we'll talk about how there's been, there's a second class one or second generation one, and then another one that was approved by the FDA. But for you, it's been 3 years in, and you said you've been able to, like that picture, you're wearing an Iron Man or something shirt, right? I mean, you're able to maintain Steven and the identity. I know you did talk about the side effects, but any last thing you want to tell people? I know people do worry about side effects and want advice on how to help manage them. So do you have any last thing to say about
Don't
that?
overthink what you read and communicate what's real, right? So what is the warnings they give you, they have to give you. They might happen a fractional small amount of time in a very small population of patients. They have to go on record. They have to document and publish them. My doc said all along, if you start feeling anything that makes you feel uncomfortable, come back to me and we'll talk about it. And we'll figure out, is it temporary? Is it, if it's not temporary, is it long-term? Is it a showstopper? Is whatever you're experiencing with the side effect bad enough to say, pull the plug, this isn't worth it? Because that possibility exists with anything that you're on. So, and I think people are afraid to take a chance on a drug for fear of what might be without ever giving what will be a shot. Because that's all that matters. What might be doesn't matter. What matters is how are you personally going to respond? And again, no two patients are going to respond the same to any of this stuff. So give it a shot and see what happens. And you can always redirect. You call it audible at the line of scrimmage, and you go a different direction, and you call it off, and you try something different.
It's great. It's a great analogy as well to bring into this. You had mentioned this before. I can't remember if during our conversation now or the conversation earlier, but about insurance and the paying for it, because that's another reality, of course, people have to deal with, which is great. We have these new therapies and the drugs. How do I afford it? How did you, reconcile with that?
Yeah, so I learned a very, very important piece of information, which I'll get to in a second. But when my doctor and I first started talking about ibrutinib in the early days, he did mention to me that it can be costly, right? So I was fortunate that the stars aligned in that by the time I really needed it, it had become more mainstream. Insurances started to pick it up, and it became the perfect storm for me because essentially it was fully covered by my insurance company, which compared to what I originally anticipated was night and day from where I ended up, right? But I also learned something really, really, really important, which is worth mentioning, that I think anybody should look into if they're on any kind of a high-end, very expensive medication. And that's that many of the manufacturers themselves have different copay programs, right? So, and typically you're not eligible if you're on any kind of a Medicaid or a Medicare insurance, but if you're on any kind of a conventional insurance, whether it be subsidized through your work or even a private pay or whatever it might be, there are organizations, and ibrutinib is one of them, or Janssen & Janssen is one of them, where they will offer you have to apply for it, you have to meet certain criteria, but essentially you can be qualified for a copay plan of like a $10 copay for your medication, which I didn't even know existed. So I actually signed up for that as well, with the urging of the team at my doctor's office. They're the ones who made me aware of it. And they said, we're going to sign you up for this, and then we're just going to wait and see who's going to offer the best coverage. So, and we actually use that too now with my wife on a different medication that she's on, where they're offering the same kind of thing, not even oncology related, but it's a different example, but another example of a manufacturer offering that kind of a plan for their patients.
I'm so glad you brought that up. That's
And to find it, just go to the main website of whoever that is. And if you search copay, or if you search that drug, if you will ultimately find it.
Yeah, no, like, yeah, absolutely. These are the kinds of tidbits through experience, right, of actual patients and caregivers that we're looking for. And if people don't know, a lot of healthcare providers and hospitals also have
Yeah,
social workers who can help you navigate through these sorts of,
yeah,
questions and find the right answers. So thank you for that, Stephen. I know that, you know, as you were saying, it's this ongoing conversation or open with your oncologist in terms of what could be next. And just always kind of having that, as part of the conversation, but maybe not the focus. Has your doctor talked to you about, um, well, you've got this BTK inhibitor, with ibrutinib. That was the first generation. Now you have a second generation. Then you just had a third one approved by the, FDA for different things. Actually, it's been a couple years maybe. And so, with all these options, has he described it to you in terms of the in case back
not
pocket
yet,
option?
because I really think his his hunch is that by the time we need to have that conversation for real, whatever we talk about now, it's going to be yesterday's news, and there's going to be something else that's that's more relevant. I've done a lot of work aligned with the Leukemia and Lymphoma Society, so I see a lot of those announcements of you know things that have been passed and funding that has taken place, and um, I, I thank God every day that I am where I am at this point in time, because I really think there are so many options available and there are so many things right around the corner that you don't have the solution you need today. You're going to have your solution every day that I'm not being treated, or every day that I'm in remission and not in need or not in a dire situation is uh, is me winning, right? Because 6 months from now, a year from now, 2 years from now, there's going to be, again, you go back into that same restaurant, you're going to open that menu and you're going to be like, oh my God, where did all this stuff come from? Where did all these good drugs come from? And that's just going to be the way it is. Things continue to evolve, things get perfected, um, research gets better, funding gets better, solutions get better. And it's an okay time to have a blood cancer from my perspective.
Yeah, exactly. No one wishes that on anyone, but it's just if there is a lot of research going on in that area, it tends to bring some hope, right, in terms of treatment and options. And another thing is, when we're talking about the BTK inhibitors, you had the ibrutinib, and then you had acalabrutinib or Calquence, and then zanubrutinib or Brukinza. And it's not just that they're newer than the first one or second one, but that they're being approved for different uses. So I know not for you, but if there's someone else now getting
Mhm.
diagnosed, that these things are being used as first line
Right.
treatments to hopefully,
Yeah,
yeah,
absolutely. Yeah.
which is so wonderful. Any last message there for people about what's on the horizon and how you tend to look at, your life and how it's, how CLL has changed or has not changed your life, especially like you're saying, you're on this ibrutinib now, and it's just you're able to do life as usual. It's not the chemo infusions you're going into and all that kind of stuff.
I think it has changed me and it hasn't changed me. And it, it how it hasn't changed me is in that I've been able to do exactly what we're looking at right now. And I've been able to continue with my lifestyle and continue doing the things that I love doing. How it has changed me is I'll look at me crossing that finish line and I'll cherish it just a little bit more. And I think I will I know I value the here and now, and I treasure time spent with my wife and kids and grandkids, and I look at things through a little bit of a, I don't know, a happier lens, I've always been positive and I've always been optimistic, but this forces me to live it a little bit more. I don't know, it's hard to explain. um, Greater appreciation for the little things in life. Whereas before, I would often think about, I've got tomorrow, I've got the next day, I've got next month. True, I still have that, but the brutal reality is we're all mortal, and we're never sure how many tomorrows, next months, or next years that we have. So it's important that you really take care of the things you need to take care of in your here and now, so that you can appreciate them, and you can really just live and love in the moment.
Absolutely. Being incredibly present
Mhm.
and living with gratitude. That's what I'm hearing as well. And I think it's clear in the pictures we've seen too. I mean, all the way up back when you were getting those chemo infusions and you said, that's not an anomaly, that smile, that's just how I am. And you continue to live that, which is so wonderful, Stephen. So thank you. My last question to you, and I'm going to try and change this photo. Well, actually, is that your doctor from?
Dr. Stephen Shore, and he spells his name the correct way, Stephen,
Nice.
as opposed to the
Um,
wrong way, Steven.
the PH, not the V. Well, I'm a PH too, so that
Yeah,
I totally
yeah.
agree. And where is he practicing? Or do you want to
Uh,
give a shout
oh,
out to
I'm sorry.
people
Yeah,
listening?
consultants in medical oncology out of Delaware County, Pennsylvania. Yep.
Gotcha, gotcha. Just because you have such rave reviews, so I wanted to get that shout out there. Um, and I also am going to stop the share. I know you had written a book, and we'll pull that image up in a second. But I wanted to ask my last question, which is how you were inspired to do that, and what your ultimate biggest message is for the people who are watching and reading this today.
So the book, the book. The book, I never set out with the intention of saying I need to write a book. What I set out with was I needed a way to get the thoughts out of my head and out of my heart. I needed to find a way to kind of purge some things and keep myself fluid in what I was doing. So, and I also didn't want to answer when I was going through early treatments, I didn't want to answer a bunch of phone calls, respond to a bunch of emails. So, a lot of what you're reading started out as blog posts where I would chronicle my day in treatment, or I would start with the beginning, where it came from, and how I was diagnosed and what I learned, and then it was through the treatments, and then through some of the relapses, and through some of the more treatments, and then I'll throw in a random thought, or a short story about something. But it was really just more for my benefit than anything, to get things out of my head and keep. It's a creative outlet for me. What I learned in the process was it helped a whole heck of a lot of people, because um, people have really positive things to say who have read it, and I think it's helped far more people than I ever would have imagined it possible. And that was never the goal. That was never my point. And um, in terms of advice or suggestions, this book is kind of fits into that category of don't let go of the things that make you feel good. In some cases, for me, that's running, and that's hopping on a bike, and that's working out. But it's also being reflective, and it's putting your thoughts down on paper, or it's putting on headphones and getting lost in a favorite album, or it's whatever it might be. So the book just kind of fell into that category for me as well. It helped me as much as it has helped others. Um, and I am kind of proud of it. I mean, it's a thing. It's an object. I've got a few of them sitting in the bookcase right over there. Um, and I don't expect everyone to go out and write a book, but at the same time, we talked a little while ago about people needing support. Some people might not want to talk to an actual person, but some people might be very good at writing their own thoughts down, right? So that might be their own sounding board. That might be their support. Maybe they go home after a tough day of chemo, and they just kind of chronicle their thoughts, and maybe when they first sit down, they're feeling very overwhelmed, and they get done writing for a half hour or an hour, and they feel a little lighter. They feel a little better, and that was kind of part of the process for me as well.
Well, Stephen, no easy feat writing and publishing a book. So that's number one. So congratulations on that. And we'll make sure to put a link to where people can get the book if they're interested on your story page. But second to that, it's what you said. I think you said it very well, which is, it started off for you as a way to just process, and then the end product ended up being something that really was a gift for other people.
Yeah.
And I think that's something that I can share with you too. It started with my blog, and then the blog turned into, maybe I can do this in a bigger way, and the patient story eventually came out of that. And now, is sort of, it's like your book and my platform. It's
Yeah.
finding that sort of voice. And I think, you mentioned this too, it's cathartic, and
Mhm.
healing to be able to get it all out there like that, which
And
we've
here's the thing, I look at myself as kind of a people broker in life in general, right? There's so many people out there doing all kinds of different things, and there's so many commonalities in what they do, and sometimes it's hard to put all the pieces together and to figure out who's connected to whom. And that's another reason why I like to put myself out there. And that makes the oncology patient caregiver community that much stronger. And what has happened by me doing that and by you doing that, we're having this conversation right now, right? And
absolutely.
you're going to post this and it's going to reach how many people? And there's going to be people seeing that, and bells and whistles are going to go off, and they're going to pick up the phone, or they're going to whatever. But I just think I won't say it's our obligation, but I think it's a real added benefit that we have to be able to improve the landscape kind of just by living our lives, which is pretty cool.
100%. I do feel that this is a blessing that I get to meet people like you, honestly. And again, we'll drop this book and the link and anything for people who are interested. But Stephen, thank you so much for spending so much time
I
with
enjoyed
me
myself.
today.
Thank you. Thanks for having me. It was great. Thanks.
And for everyone interested in Stephen's story here, just head to thepatientstory.com, where we give human answers to your cancer questions.